Well, it's time now for our In Focus Health Update. Health reporter Lino Mudu joins us now with a look at tuberculosis.
Well, tuberculosis, or TB, is an infectious bacterial disease caused by Mycobacterium tuberculosis. The bacteria usually attack the lungs, but it can attack any part of the body, such as the kidney, spine, and brain. TB is spread through the air from one person to another. Experts say TB is a leading cause of death among people who are HIV positive. They say multi-drug-resistant TB and extremely drug-resistant TB pose a serious threat to TB control. Some signs and symptoms of tuberculosis may include coughing up blood, chest pain while breathing and coughing, weight loss, night sweats, and fever. Well, as World TB Day approaches, global health experts are focusing on a lethal lineup: HIV, AIDS, and tuberculosis. As we mentioned earlier, TB is a leading cause of HIV-related death worldwide, and Swaziland has the highest HIV/AIDS infection rate in the world. Now there is a growing threat from multi-drug-resistant TB, an aggressive strain that is much more difficult to treat. VOA's Khalil Gay reports.
In the mountainous kingdom of Swaziland, the Red Cross van winds its way along the dirt roads and up to the remote rural homesteads. It is vital to get medication to people like Kulshili Nyamani, who has contracted multi-drug-resistant TB. It often occurs when patients don't complete their initial treatment of TB.
I think it's very important for us to bring the services to the people, not the people to come to us. If we can do that, I think we can eliminate it in Swaziland completely.
That's a huge challenge in a country which has the highest AIDS infection rate in the world, and TB is rife. But small victories make a difference. Kulshili is getting better.
It makes me happy to know that I'm feeling stronger. I'm going to take my treatment until the virus has gone completely.
Nurses and healthcare workers are especially vulnerable to TB. And in the bustling commercial capital of Manzini, there is now a special clinic for them. Fetsili Mamba, who has won an International Council of Nurses award for her work in TB, is there to support her fellow Swazi nurses.
They feel cared for. They feel they have something that is taking care of them.
In turn, nurses like Laurine Dlamini, who contracted TB at the local hospital where she works, can face her daily work with confidence.
I can have ways to stand those challenges, if I may say, because I've been treated and I feel fit and I'm more energetic.
It's clear that a passion for treating TB is needed in this small African country, and a worldwide push to reduce it globally, says Lushika Dishu, the Executive Secretary of the World Health Organization's Stop TB Partnership.
We need to do everything we can to dramatically reduce tuberculosis globally. We can do it only in partnership, and only if we can work together, we can find new ways to prevent, diagnose, and treat tuberculosis.
Despite hardship, the people of Swaziland are resilient. There are many who are determined to work together to beat the scourge of TB and AIDS, so that the children of this country can move into the future with hope. Khalil Gay, VOA News.
And that's all for today. Vincent, back to you.
Well, Lino, thanks very much. Be sure to watch Lino Mudu's informative health reports every Tuesday and Thursday right here on In Focus.